is basically, suppose yes or no. Simply we can ask, for example, pathology queries. Suppose patient admitted with the liver mass. I had patient admitted liver mass, and he done biopsy for liver and sent discharged. Okay, that liver mass sent to pathological examination, and pathology report came after discharge of the patient. Patient got discharged, he went home, but pathology report came after 2 days, 3 days. So that time physician doesn't know patient has cancer. He just documented liver mass. So pathology, who will do that? Pathology agreements, MD pathology will do some other physician will do the pathological examination of the condition, that liver mass, and he identified there is a liver cancer is there. So then we found documentation that only pathology report has a cancer documentation, and remaining all the documentation and maybe attending physician documented only liver mass. So then we can raise query, then we can raise a query same way based on pathology findings. We can ask like, based on pathology findings, like this. You can ask pathology findings, pathology report findings. So are you agreeing with, are you agreeing with, agree with pathology report? Okay, understand. See, nothing. He's asking like question, are you agreeing with the pathological findings? Okay. So then we can ask, we give options. No need to give multiple options here. One thing can give, one thing yes, second one no. That's it. Then you can select yes means we can go with the cancer yes to code. He said no, then you can go with the without cancer diagnosis. Right? Yes or no means just nothing. We can ask like anything you agreeing or not. Like way, same way you can give so many other like pathology. Most of the time yes or no we can use pathological, and suppose CHF acute or chronic, that is also we can use. It's a acute chronic or something, we can ask like that is also yes or no questions like that. Okay, multiple choice, yes or no, and open-ended queries. These are the query options. Okay, anyone has questions here? Multiple choice is the most best choice. We can raise a query, and yes or no based on our query options. So let me explain again into these examples of these queries. Then you'll get more clarification here. So this document, Shiva, you explained this document anything previously? No, right?
No. No, I explained only types of query like acute query,
Okay, okay.
laterality query. That queries I explained actually.
Okay, okay. Then. Thank you. Okay, guys. Let me explain that. I just before I discuss this 3 types, I'm going to explain that example of open-ended query. Just now you can see here, patient admitted with pneumonia, and HNP reveals that WBC, respiratory rate, temperature, and heart rate, hypotension. This is all. What is this all? What is all?
Indicators.
Clinical indicators.
Clinical indicators. We can clinical indicators. What is this last final? IV antibiotics, IV fluid resuscitation. This also treatment. Okay. So what I told before query, what we need to have, we should have medical documentation. Correct. He mentioned admitted HNP examination reveal. So he mentioned documentation also. He mentioned some indicators. He mentioned, and finally he mentioned treatment also. This is the, we need to provide this all, and he explained how to leading, how it is leading and not leading also given. See, leading means the patient has elevated WBC, tachycardia, and given antibiotics, and cultures, and are you treating sepsis? Like he has a, it is a leading query, right? What you do, just before we discuss what is leading means nothing. See, he mentioned only indicators. It doesn't know, it doesn't have mentioned where is the medical documentation. It doesn't mention. Just he mentioned the indicators, and he may asking direct question, sepsis. Then what is this? We need to ask non-leading. Based on your clinical judgment, can you provide diagnosis of represent that below listed clinical indicators? So this is the open-ended query. So you're not giving any options here. So what I asked here, based on your clinical judgment, can you provide a diagnosis that represent the below listed clinical indicators? Below means you mentioned below, that is what is given. If you mention above means, if you provide these indicators and above, then you can mention ask above listed clinical indicators. This is open-ended. We are not giving any option to the physician, then we can call it as open-ended. Then physician came with his response, own response. Like maybe he will tell, yes, I'm patient has sepsis or not. They will tell directly. So this is open-ended. That is clear, right? So clinical, see, complaint, non-complaint, or leading, non-leading, both are same. That is, remember that. And leading means he is not providing. See, leading means we should provide all the, what are the three parameters I said? One is the medical documentation. Second thing, clinical indicators. Third thing, treatment. That should be provided, and question also very should be polite, and we should ask very clear and concise. Then we can say it's a complaint query. So this way you are differentiating that what this base same question is differentiating like leading, non-leading, how it is. It is an open-ended query. We are not providing any option to the physician, then we can call it open-ended query. And comes to multiple choice query, example of multiple choice query, how it is like. Now see, patient admitted with the right hip fracture, and the HNP notes that patient has a history of chronic congestive heart failure. Guys, focus on documentation. Patient admitted to hip fracture, and HNP notes that patient has a history of congestive heart failure, and recent echocardiogram showed left ventricular ejection fraction is at 25%. The patient home medication includes metoprolol XL, lisinopril, and Lasix. Okay, can you tell me anyone what is the query you are going to raise here? Anyone
Systolic
getting
heart
this?
failure.
Sorry,
Heart failure.
heart failure, correct. So what will raise
Systolic
query?
heart failure.
What query you
So
will
it
raise?
is reduce ejection fraction. So we have to raise for systolic heart.
Right. Okay. Recent echograph, you said history of chronic congestive heart failure. Correct. Chronic congestive heart failure you mentioned. Then what you missing here? In this word, what something we missed here?
Specification.
Type, right? Diastolic, systolic.
Right.
Yeah, we doesn't
Specificity.
have that. So that is what we need to raise query now. Okay. So what clearly I told before. What is the complaint query? We should have documentation, clinical indicators, and treatment. We have or not here. See, HNP said where it is located. HNP. HNP says that patient has a chronic congestion. So he provided medical documentation here. Then what is indicators he provided? Echocardiograms showed left ventricle ejection fraction 25%, and he used, so this is the one indicator, and he provided medical documentation, and he provided treatment also. Then it is a complaint query. So we can ask question, suppose same documentation, we can ask you, suppose just is, don't confuse here leading, non-leading. Leading means please document if you agree with the patient chronic diastolic heart failure. If you're not providing all these indicators, if you thought providing all these, just he asking please document if you agree with the chronic diastolic failure. Maybe he provided only this one, this part only provided. Then he asked this question, that is leading out, obviously because of remaining clinical indicator and treatment we are not providing to physician, then you are automatically leading. Then non-leading, what is non-leading means? Complaint query, it's a complaint. It is noted to impression. So he mentions here non-leading means in HNP is noted to have patient chronic congestive heart failure, and recent echocardiogram noted everything he mentioned clearly. So this is the complaint query. Then he asked question like, see, multiple choice. So chronic systolic heart failure, chronic diastolic heart failure, chronic diastolic systolic heart failure, same other type. So other please specify, unable to determine or undetermined, right? So this is the multiple choice of example. And same way we explained here what is compliant, what is leading or non-leading. Okay. Any questions here so far? Are you
No, sir.
understanding? Clear, right, everyone?
Yes.
Okay, then it's a clear means it's a good. So because of query questions will come more in the examination, so query part is very important. So
The patient details are not there, no? That also you mentioned before. We should put those details.
Jamuna, can you ask me again once?
Patient details.
Patient details, yeah, that should see query form, that is comes to query form, not about to query options here. Like I can say the default query form we are sending obviously will fill the patient demographic automatically. If something questions related to comes that if suppose in examination they will ask you like are you including patient demographics in the query form? Yes, definitely will include. That way you can think, but we need no need to provide every time. So just we are explaining what is the options here, but we should include patient demographics in the query form. Okay.
Okay.
Yeah. So that understand multiple choice, open-ended, and leading, non-leading difference you understand, right? That is that leading means, what is the meaning leading? Another name?
Non-compliant.
Yeah, correct. Non-leading means complaint. Then, so open-ended, multiple choice we done. Now we already discussed yes or no. We just again I'm giving one more example here. Example of yes or no queries. Clinical scenario: patient admitted to with cellulitis. Okay, patient admitted around a recent operative wound site, and only cellulitis documented without any relation to the recent surgical procedure. Okay. Now what is the patient comes to with the cellulitis? Okay, where it is cellulitis happened around the recent surgery. It's happened recent surgery, maybe it's a 1 month back or 15 days back or 2 days back. Recent surgery, something happened, and around the recent operative site he got some cellulitis. Okay, and only cellulitis documented without any relationship to the maybe he's not documented the, maybe he said it's a related to surgical sites, maybe the due to surgical site, maybe surgical related to surgical, then automatically complication will go, right? It's a post-surgical complication will go PDX. So principal diagnosis will give you that. So it doesn't mention that there is no relationship between the cellulitis to the surgical site. It doesn't nowhere documented. Physician doesn't mention that cellulitis related to that. But he mentioned that only thing around, he said around means it's not related. Maybe it's related to surgical site. It is not be related to surgical site. It doesn't mention that relationship between the cellulitis to surgical site. So now our question, query, how will ask query? Is the cellulitis due to a result of surgical procedure? Please document your response in the health record. Like this also we can use query option. He mentioned yes, if no, other, clinical, unable to determine. You can give these all options. Understand, right? So yes, so yes or no queries based on our convenience, based on our options. So we basically our code or option only, but we should choose proper concise query form. Multiple options is very good. When you are querying physician, we have option to give multiple options to him get it, but sometimes see there is no required cellulitis is due to, and we can give this way also. So for example, this query also we can write another way. Two options we can give: cellulitis due to surgical site, cellulitis not due to surgical site, other, and please specify. Also we can use multiple options also for this query, but here we opted for like yes or no queries only. We opted option as a SR query. So that way you can ask, is this cellulitis due to the result of surgical procedure? Please document your response in the below record as a below. If you mentioned yes, means we can take it as a relationship between the surgical and cellulitis. Understand, right? So nothing but our convenience. Maybe we are rising based on our documentation, our convenience. We can ask question framing by yes or no or multiple choice open-ended query. The three ways we can ask. Most of the time multiple choice will use, and second it comes to yes or no, and third option we can use open-ended query. Okay, why? Because based on our options, based on our options we are giving to physician, we can see multiple options means we can give more options to physician. So we have less options, we don't have multiple options we give him, then we can give yes or no. And we doesn't have options to give him, then we can go with the open-ended query. Understand, right? This was clear, right? Everything.
Yes.
Yeah. What we covered today's topic: query, physician query. What is this? Complaint query, non-complaint query.
Open-ended.
Complaint, non-complaint first. Okay.
Open-ended query.
Yeah. One more thing, complaint and complaint. And concurrent queries. What is a concurrent query? Retrospective query. Right? Retrospective. Remember, right? What is a concurrent, what is retrospective? Okay. Complaint, non-complaint, concurrent, retrospective. Now, options query options. What is that? Open-ended query.
Multiple choice.
Multiple choice query.
Yes and no.
Yeah, multiple choice, yes or no. Understand, right? So what is this all? Easy, right? Nothing is difficult here to understand. It's a very easy. So complaint means what is that? What I told, complaint means?
Non-leading.
Yes, non-leading. Good. What are the things we need to hear? Medical documentation should be there.
Clinical indicator.
Medical indicator, clinical indicator, treatment and question.
Precise documentation.
You should check if you are seeing your question. We should identify this medical documentation, clinical indicator, treatment is there. Then you can go with this. It's confirm. It is a complaint query. It's a confirm. It's a complaint query, non-leading query. If something is missing, medical documentation. Suppose I provided only medical documentation. Then what is? It's a non-complaint, right? I'm not provided any clinical indicator treatment. Then obviously it is, right? Okay. So like this. No other documentation provided, no other support. No other supporting provided. Okay. Then it is automatically we provided only medical documentation, no other supporting documentation not provided. So means that the clinical indicators or maybe we are not providing any treatment. Then automatically it's a non-complaint leading query. That way, should if any query in question you are seeing any question, you should identify. Okay, there is a medical documentation, there is a clinical indicator, there is treatment. Then if default it is a complaint query. Okay, if something is missing, then automatic non-complaint query. Remember, right? Then comes tell me that what is the concurrent query?
Present. When
What is the
patient is present
While admitting
and
only.
patient
while in the
admitted.
hospital, while in the hospital, correct? In hospital only. Who will raise these queries? Who will raise?
CDI coders.
CDI coders.
Correct. CDI coders. What is the meaning of CDI? Clinical documentation improvement. So what the CDI coders function means role is that? What is the roles of responsibilities that he need to improve the documentation. So CDI coders doesn't want to code the account. He should has complete documentation available while patient discharging out. So CDI coder responsibility to complete the what is the any gaps in the documentation or something incomplete or lacking of documentation in the medical record, then CDA coder responsibility to that send a queries to physician, ask him to complete the documentation. Maybe he mentioned like suppose creatinine is documented in the admission. For example, for example, what is the concurrent query? Patient admitted today, for example, 22nd. Okay, 22nd admitted to hospital. Okay, and 22nd, what are the documents we'll see? For example, today admitted to patient. What are the document? ED will be there. Okay, first ED, HNP, maybe first day of progress note. Correct. First day of progress note will be present on 22nd. What are the documentation we'll see? On the first day of progress note, ED will see, HNP, maybe first day of progress, we can see on 22nd. Maybe 23rd, what we'll see? Maybe one more progress note will happen. One more progress note, maybe consultation also. Second progress note. Second progress note, maybe consult will come, consult notion also. Correct? Consultations. Correct. See, for example, he mentioned here creatinine abnormal. Creatinine value somewhere 1.5 something mentioned. Okay. But he doesn't document. It doesn't document anywhere in HNPR this progress note or this consultation now nowhere documented. Then CDA coder has responsible to that. Okay. And he mentioned somewhere he documented IV fluids is giving to patient somewhere. Okay. So 1.5 is the abnormal and IV fluid is a treatment for the acute kidney injury. Okay. Clinical indicator is very important. Acute kidney injury is the indication for the creatinine and IV fluids for that treatment. So now CDA coder, what he will do, he's not discharged. He's still in the second day of that. Now he CDA coder will take this account, patient account, and he will send a query to the physician. Can you clarify that patient has a creatinine 1.5 and you are giving IV fluids? Can you confirm that patient has a acute kidney injury or not? That responsibility means he need to clear that. So somewhere he left the, see, what is, how you feel that he giving 1.5 and he is giving IV fluids, then what? Physician is missing documentation, right? He's missed to document the acute kidney injury. Maybe he's treating everything. He knows that creatinine is abnormal and starting treatment IV fluid. But what is he did mistake? He missed the document the acute kidney injury. That way, now clinical CDA person, what he will do, he will identify all the clinical indicators and treatment, everything if given to the physician. Physician, you means doctor, you missed this one. Suppose you can, if you agree this, suppose you about to treat this same condition. Suppose you are going to treat this, are you treating this acute kidney injury? Definitely should document that. Then obviously, suppose the patient discharge after came to the our medical coder, maybe it's onshore coder somewhere, and if definitely he will find some CDA queries raised, and if he responded back like, okay, physician, patient has a acute kidney injury, then automatically now medical coder doesn't have any problem to sending query again to the physician. He already has documented acute kidney injury patient has. Responsibility to fulfill the documentation or lacking of the documentation, he can fill the documentation properly and before discharge. That is a CDA coders. So that we can call, that way they are called CDA coders, means clinical documentation improvement. They will do improvement in the documentation. And same way CDA coder, what is the another responsibility? He should educate the provider. He can provide the education to the physician also. So in what way he will provide education? Suppose, for example, I am the physician. So I'm my habit that I'm missing to give some information in the operative notes. Every time missing some information op report note. So okay, then CDA person, what he will do? He will do all the documentation what I'm providing to in the health EHR, electronic health record, and the CDA person review that everything, and if he will connect with me and doctor, you are missing every time in the operative note somewhere, you are missing to document this part. Then obviously I will correct myself and I will do next time. I will improve my documentation in the correct way. So CDA coder responsibility, one thing he should have CDA queries and everything, and also he should educate the provider where he missing and where he need to improve that documentation. Understand? These questions also will come. So this one clear? Concurrent query. Now what is the retrospective query?
After the discharge.
Correct. After the discharge. Retrospective is nothing but after discharge. Okay, that's what clear. And open-ended query, that is no option, no multiple, no options we are giving. Okay, open-ended means no options, multiple options. There is no limit in the options. Okay, remember that, no limit in this. We can give any n number of options here. No limit. Yes or no, you understand? That is very question, straightforward questions. Okay. Okay, done. Everyone clear in this? What is the complaint, non-complaint, retrospective, concurrent, and options of query, open-ended, multiple choice, yes or no? So if it's clear that, now you're able to send a query also. If anyone want to send a query, Remember this. You can send a query to physician based on this your findings. I am done my side. Do you have any questions? Ask me.
In yes or no, we don't need no need to give clinical indicators, huh?
Yes, we can give. See, forget about options yes or no, multiple choice, or it's open-ended. We should remember mind. Medical documentation, clinical indicators, and treatment should be provided in the query form. Without missing it, we should not miss anything. If anything,
Okay.
that is what. Don't assume that is yes or no queries is not providing all this. You should provide all these queries.
Okay.
Okay.
Only it's a non-compliant query. We don't need to give all the details.
See,
Right.
non-compliant query we should not raise at that. See, nothing non-compliant query. It's type of question only. See, generally non-compliant query we should not raise. That is what we say. It's not a type of query. Don't think it is a type of query. It's a we
Just-
should not raise. So just giving a difference between the what is complaint query and non-complaint is what is leading non-complaint, just difference. That don't think it is a type of query. We should not raise the query non-complaint query, non-leading query. That is what. Any other questions?
Hello, sir. I'm asking.
Hmm.
Those, I mean, those compliant queries, non-compliant queries, that can also be retrospective queries. Like
Complaint query, non-complaint query, retrospective.
I'm asking. Yes. I'm asking if the query is raised by medical coders, then it should be retrospective query, right?
Yes, it's a retrospective. Obviously, you after discharge, you are rising query. It's retrospective.
Yes, and these type of queries are not for these queries are not concurrent queries, right?
No. Yes.
Okay.
It's nothing but complaint, non-complaint means we are this is a guidelines. We should ask physician in the same for this. It's a format kind of thing. So it's a kind of format. We can ask a physician in the complaint way. Means it's no there is no complaint from the physician. That's why we should go with the complaint, which is a formal way. It's leading. That is what it should not a like type of question. It's a type of format. That's it. Okay. Any questions apart from this?
The complaint query and open-ended look like same, right? Or any difference there?
Complaint query and
Open-ended.
yeah, see, complaint query. I'm talking. Oh, see, there are. I told there are three topics here: complaint, non-complaint, concurrent, retrospective, open. These are query forms. We can use options. Suppose open-ended query means this is type of. This is a one query form. This is a one query form. These are three query forms. We're used option open-ended query. We are using a open-ended query. We are giving only question. We are not providing any options to him. That means it's not a complaint. Don't think about it as a complaint. It's a complete difference. Different from the I say complete. It's options of queries. It is a complaint query is nothing but complaint query. Remember that complaint. We are sending any query. I told you right before also. 1 minute. So suppose query we are sending. What is that? Patient demographic should include. Okay, patient information should include here first. Next, what we'll do? Medical documentation, correct?
Yes.
Medical documentation should provide. Next, what will provide? Clinical indicators we can provide. Next,
Yes.
what will do? Treatment. So this thing, okay. Then our question, correct? This is complaint query. I can say this is the complaint query. Now we are until this question. Now what are the after this we are can call as the complaint query. Okay. Now we have options. We have what are the options? We have open-ended option. We have multiple options. We have and yes or no based on our convenience, based on our options. Maybe our max what we can send the options like we don't have multiple options. We can ask directly open-ended query. Can you please confirm that above medical documentation? What are that? We have medical documentation, clinical indicators. Can you please can you confirm that relevant diagnosis? Can you provide relevant diagnosis? That way you can ask. That is open-ended query. We are not giving any multiple options. Complaint query means nothing but we need to see. Complaint query should have these all parameters. This is again called as a parameters. We should have that. Complaint query means definitely it should have these parameters. Without these parameters, we can call it as a complaint query. If any parameter is missing, then automatically is non-complaint query. Okay. And coming to the options, query options, after question, we can give you options to physician. There is of 3 options we are used: open-ended, multiple choice, and yes or no. That is also your choice. Your choice to send a query. If you want to select multiple options, you can select multiple options. If you want to select yes or no, you can select yes or no. But it's not related to complaint, non-complaint. It's a different part of sending. That is completely different from the complaint, non-complaint. It's complaint query is nothing but open-ended means open-ended has a query means it's a complaint query. It's not related to open-ended. It's not related to yes or no. It's related to multiple choice. You should first frame the complaint query, then you can give your options. Maybe you should go to multiple option. Either you should go open-ended, you should go with the yes or no. But understand, right? Clear?
Yes.
Okay.
Yes.
That's okay.
Yes.
So my part is done. Then any questions still?
For concurrent queries, also same format we will follow. I mean,
Yes, yeah. Query means you can use same format. No more, no excuses, no options here. Concurrent, retrospective, both are, we are sending physician query means we should have this format. Okay.
even though we don't have the access for their queries, right?
Mhm.
Concurrent queries.
Okay.
We will-
Yeah. That's
No, I'm asking, do we have the access for seeing the concurrent queries? Because that will be given by CDI, right?
yes,
CDI portal.
we that see something, see how it is, right? If you, so for example, forget about CDA. For example, you are the coder, you raise the query. Okay. So you send a query to physician, then automatically hospital HIM is there. HIM means what is health information manager. Somewhere one manager is there in hospital. What he will do after responding of query from physician, he will add that same query form, query document in the your medical record. So obviously, what for example, you are able to see disassembly, same like query form, they will add in the second, maybe somewhere in the medical documentation. You are able to see, and same way, CDI raise the query. That query form will add the documentation somewhere. You can see that query form also.
Okay.
Okay, good. Anything?
Hello.
Yeah, Sai Krishna, tell me.
Bhaiya, I have one doubt. Actually, I am outpatient for ED department.
Okay.
We are not sending any pending. We are not sending for any query and all. What will be that in document? We are coding.
Correct.
If
Yeah.
have any deficiency means, we will send the chart. If I have any documentation deficiency.
Clarification. Correct. For clarification.
Yeah, send that one.
Hmm.
But in actually in IP, if you having any diagnosis, also having any doubt means, you are send for query.
Yes, correct. Yeah. That's true.
Actually, it will be having any software for this for sending query and all.
Yes.
We are
Actually,
working software, no? It will be
yeah.
option for the pendant. Will that click that option, it will go for pendant.
Correct. See, for
Like that,
example,
it will be, yes, tell sir.
for example, if suppose any missing documentation, HNP or maybe DISA summary or consultation, something you missed it, we are pending. We have some drop down list. We are selecting a specific drop down, and we are pending for documentation, any missing documentation. And same way, for example, you can take as a inpatient account.
Okay.
Based on our hospital, suppose I work some hospital,
Okay.
there is no separate tool for the sending query. So for that, hospital requested us to send a query in the document you write. What document? We need to create what we created here, right? Query and the patient information, everything I should include in the document. I can send through mail, and that hospital manager will take it to the physician. Then they will answer that query. They will add into the our medical document. That way, one process. And some hospitals have separate software for that, and they will have separate option to have query options, everything, then we can submit in software itself. Automatically it go to physician, then physician will answer back. That way, 2 ways it can work out.
Okay.
Okay.
Sir, I'm understand.
Understand? Any questions? Okay.
Yes, sir, understand.
No, thank you. Anyone still? Anyone?
For sending this many options is there, like this many formats. So why we need to follow this many formats,
Why?
sir?
Because see, suppose for example, if you come to real time of coding of IP, then you
Yes,
will
sir.
understand. See, but sometimes we doesn't have how to ask question. Also, sometimes we doesn't have how to ask questions.
Okay.
We know we doesn't have the option to provide him also. So that way we have so many are there. We can because of giving multiple choice and creating confusion for the physician. Because of
Okay.
that, we can leave him open-ended query. Then he will come with his answer. Like that is what.
Yes, sir.
Just giving this information for your understanding. Going to exam, then you can understand easily. Somewhere they will ask question, you will identify easy. That's what I'm giving here. Yeah, guys, anyone has any question, then ask me, then we can wind up otherwise. If everyone is clear, then I'm good. I'm also everything done.
Is the query class done? I mean, entire concepts in the query?
Jimno, can you speak loud little bit? I'm not getting your voice.
I mean, entire concepts in query is done.
Yeah, query session, you're asking query session done. Yeah, obviously, I think one session done by Shiva, right? Yesterday.
Yeah.
Yeah, almost done. The query session is completed, and maybe Shiva will take you maybe some example. I don't know that what you will take, but today I came with this query, especially complaint non-complaint query option. I need to explain this. I came to today. I'll Shiva let you know that what is next schedule on the queries. If you feel that everything covered, then he will. It doesn't have any class more further. If something is missing in the query, then he will take you another session on this.
Okay.
I think he has provide some document related to your query, some examples related to queries. Then you understand easily. Then more examples on this.
But I was not told about you. In between your came, you taken class.
So, Sai Krishna, tell me one. I came in between. Yeah, today I came. He requested me to take that class today. So I feel that you understand. Everyone understand how it is. Are you able to understand how it is like?
Yes, you are nicely told. We are understand.
Yes, I understand.
Yeah. Thank you. Okay,
Thank
let
you.
me. Any questions? Let me know. Are you post to Shiva also? Any questions? I will clarify that definitely. Okay. Then I can wind up this today? If doesn't have any questions,
Yes,
any. Yeah. Thank you.
yes.
Thank you all. Good night.
Thank you, Bhaiya.
Good night.